Welcome to continuing coverage of the World Healthcare Congress 2012. In the studio we have Harry Reynolds, who is Director of Health Industry Transformation at IBM. That's a big title.
Well, it's fun. It means I get a chance to pretty much work with the entire healthcare industry.
Yes.
I report to the gentleman that runs all healthcare and life sciences globally for North Carolina, or for United States, or for IBM, excuse me.
Yeah.
And it's really, really exciting. This is such an exciting time in the industry, and the thing that's really fun about being at IBM is everyone in the healthcare industry is usually our customer in one way, shape, or form.
Absolutely.
And so that's really exciting.
You said exciting. Is it also a concerning time because there's a lot of uncertainty in the sector right now?
Well, the status quo is concerning.
Yeah.
Probably more concerning than
So
anything we
change.
would change to. And so I think it is invigorating. I'm a grandfather and I have a grandson, and we need to make some changes.
We had talked about in 1998 that 10% of GDP was not sustainable for these costs, but now we're looking at almost 20%. Where do you think we're going to from here? Are we going to see the cost dip down lower or go up higher before there is that change that we need?
Well, I think the models are starting to change. So I'm not going to predict an economic number or anything else. I'd say the models and the way the industry is engaging is incredibly enlightening right now. Excuse me.
No problem.
I think that, with medical homes and new care models and payer-provider convergence and the focus on the individual, I think is dramatically different over what it has been up until now.
What's happening behind the walls at IBM that you see might provide a good example of what the industry can use as an example?
Excuse me, I just spoke, so
Oh, sorry, sure.
struggling here. I think a couple things. Let's talk about us as an employer first.
Yeah.
We insure 450,000 individuals. We have set up our benefits such that our employees can get unlimited primary care visits for no copay, no coinsurance. We want them at the doctor. We love the word presenteeism versus absenteeism. So we really promote that. We're promoting a thing called the medical home, which is more team care for our individuals. And when we bought our insurance this past year, we made sure that the people we bought it from, the payers, were in fact driving that throughout the industry. And obviously we're an advocate of this change. We spend about $1.6 billion a year on healthcare. So if you want me to say that I'd like to see it go up, you're not going to hear that.
Right.
Having it go down and really focus on the individual and have better quality is what we're looking for.
Now, what about health exchanges that we see really taking off in some other states? Do you think we'll see more of that happening independently, and is that a move we need to see?
Well, I think when you say insurance exchanges, I think there's a couple of different kinds. There's the one that's in the legislation, which means more and more Americans getting care. That is a big one. Obviously, it's exciting if more people in the United States have care. The thing that's going to be interesting is that many new people trying to buy their own insurance.
Yeah, big challenge.
So really trying to understand and have those people understand what they're buying. How does it relate to their monthly budget? How does it relate to affordability? How does it relate to the doctors they would want? How does it relate to the conditions they have? How does it relate to their family? So yes, exciting, but it has its things that have to be closely watched. You're also seeing more and more efforts to have more competition and people be able to buy that even if there isn't a regular federal exchange. So you're seeing more and more payers and providers and others trying to offer benefits that an individual could buy. So again, just part of there's probably about 25 subjects that are out there right now. Health insurance exchanges is one of them as far as access. But then once you get them into the system, we still have to care for them different. We can't stay with the fee-for-service. We can't stay with the same there, or our costs are going to continue to escalate.
IBM, of course, is in the business of technology. Do we have enough technological innovations out there to support the kind of information exchange that will support a stronger healthcare system?
Oh, absolutely. I mean, I think that the innovations are endless. The question is, do the care models and do the businesses and the payers, providers, and others align to where they can take advantage of that information, and do we bring the consumer into that information? So,
what is the answer to that?
Well, I think there's a couple things. I think you're making things much more transparent for the individual. I'm sure you have a smartphone or you don't have a dumb phone, but the point is you have a phone that allows you to do many things in your life, but it doesn't allow you to do much health care. So as you innovate, how do we bring healthcare into the mainstream of how you deal with you? How do we engage you? How do we get you excited about doing things? How do we show you what will happen if you don't do it well? Obviously, you've heard what we're doing with Watson. You know, where we developed Watson for Jeopardy, and now we're moving it into healthcare and working with people. So our most recent one is with Memorial Sloan Kettering, where we're working on oncology. So how do you really start getting to evidence-based? How do you start getting this information out to more places, and how do we do it, you know, in a way that people can much more pragmatically use it and update it on a continuous basis? So plenty of innovation, plenty of people doing it, but it's got to be a marriage of the consumer, the people that are actually running healthcare, the payers, providers, and others, and then those of us that are technologists.
All right. Well, thank you for stopping by.
Well, thank you.
Really appreciate your time.
Thank you.
You're watching continuing coverage of the World Healthcare Congress 2012.